right, we're continuing our self-care special. Your skin is the largest organ in our bodies, and when it's on point, you feel great.
Family nurse practitioner Neha Bengal joins us now with everything you need to know about chemical peels. Thanks so much for being here.
Thanks for having me.
I think you put the word chemical in front of anything and people are immediately scared of it.
Yes.
This is true. The chemical, well, let's talk about skin. Okay. Chemical peels for your skin in particular, not just face, body, everywhere. You shouldn't, like Tanya and I had talked, it shouldn't burn you. It's more so to get off that initial layer, help with the dead skin, the dry skin, the unhydrated skin, the maskne that everyone is dealing with, just to kind of jumpstart other procedures. So when you're doing chemical peels, the goal is let's get off the first layer of your skin, and then let's do other things like microneedling, Botox, fillers, hydrofacials, things like that to kind of tie it in all together to get that radiant glow.
So it would normally slough off anyway, so you're not taking off anything that wouldn't come off eventually.
Correct, to an extent. There are different kinds of chemical peels. The VI peel that I love in particular, I love it so much because it's a medium depth peel. So you will be shedding layers of skin that you will see in the pictures that we can put up later, but it is actually truly taking off that entire first layer of your skin, the dead skin, acne filled, melasma, hyperpigmentation, it will all come off.
Okay, so I get it for like talking about for acne, but what are some other things people use them for?
So we have 5 different kinds of peels, and it's good for every skin tone, every skin texture. There's not like one of these peels isn't going to be good for you or me. Like it's
universal.
Anybody can use it. Yeah, anybody can use all the peels. But we have some for melasma, hyperpigmentation, acne scarring, just a regular peel. Like somebody's like, hey, I have great skin. Tanya has phenomenal skin. Right? You're like, okay, I just want to do something. Well, let's get off this, this dead skin, get that summer glow in the fall and winter, so you're good.
Oh, okay, all right. I mean, I've done a peel before, but it was always because of a acne issue. Yeah. So I remember as we were talking, someone left it on too long and I got burned. So I get a little afraid of it. But recently I started using a facial wash that has like a glycolic pill in it.
Oh, yeah. Those are wonderful.
Yeah. Right. I use it a couple times a week because we use so much makeup and I just want to make sure I get in there and get it all out.
Right. And those are beautiful. Again, you don't have to do a high intensity peel like this. There are so many different kinds out there, like the TCA peels. Our esthetician does a wonderful job of just doing a facial and then adding in like a natural peel that doesn't cause your face to shed ultimately, but it's great to do this, and it's a precursor. I tell people, you want that radiant skin. Do the peel first, get off that dead skin, and then do other things like hydrofacials, like I said, microneedling, all the other esthetician things out there, or the cosmetic procedures out there to make them last longer, and you get like better results.
Okay, so when should you do a peel, and then how many times, I guess, a year would you do a peel?
So you should ideally do these peels in particular in the fall and winter, because when you shed, you don't want to do exercise, you don't want to be out in the sun, you can cause more blistering and more hyperpigmentation.
Got it. Okay.
You want to do it in the fall and winter, typically 1 up to 3, and you want to space them out every 6 weeks just to get the maximum results. Okay. But there's patients that I see all the time that'll just do 1 peel and they look amazing.
Yeah. Does it work for aging skin too? Is it for anti-aging?
Yeah, we have an advanced peel. It will help build your collagen. And yeah, it's wonderful. Build your collagen, stimulate all those cells, and it will, there's actually a picture that I submitted and you can see it, like she looks like 10 years younger.
Oh, wow.
Oh, yeah.
Wow.
Okay.
So that was an advanced peel that I did for her, and it was beautiful. You can see the redness, the skin pigments, all those issues are just resolved, and that's in 7 days. You peel typically about 3 days. The first 2 days are not so bad, but day 3, 4, 5, you do typically shed those layers of skin.
Is it very irritating? I know some people would be worried about, like am I itching?
It is. It can be. It's very tight in the beginning, and you do kind of feel this burning sensation. The kit comes with hydrocortisone that we can add on there, but Aquaphor. Aquaphor is my best friend. It's the most generous thing that you can put on your face. It will lather it, so it's not as dry and burning sensation feeling, I guess.
Yeah, because I already have dry skin, so would that make it drier, or would that help also get rid of the dryness?
It will help. It will make it worse at the beginning, and then afterwards you will feel more hydrated.
Okay.
Yes.
Pain is beauty, man.
Beauty
is
sure
pain.
is.
Beauty is pain.
I know you mentioned too, like adding the other things, like if you do Botox and stuff like that. What is the benefit of doing overlapping the procedures?
It's just getting the maximum results. So adding you can add Botox the same day you do the chemical peel.
Okay.
So in 3 to 5 days, those wrinkles, those muscles that, contract to make those wrinkles will be frozen, and then it will also, the peel itself will help with those fine lines and wrinkles. If you do dermal fillers or if you do microneedling is like pretty much a pen and you puncture little holes in your face, it will help build those collagen. It'll just kind of stimulate all of the good new skin. And then you can also do fillers, you can do hydrofacials. There's every procedure out there, sun damaged skin, H-spots, you can use like a BBL machine.
Yeah.
You can use that in combination with this to get the maximum results in, less than a month.
So how long are you out of commission? Like, most people, if they have something done like this, they want to, be away from the public eye.
For 4 days.
4 days.
4 days.
4 days.
Day 1 and day 2, not a big deal. Day 3, 4, 5, maybe day 6, you're going to peel a little bit.
Okay.
Or just, go to work and don't care. Your coworkers don't care.
And you
so
wear a
no
mask
matter.
anyway.
Right.
So
Good
it doesn't
point.
matter.
That's actually a really good point.
Yeah.
Fantastic.
Love that.
Yeah,
Love
me
it.
too.
All right. Thank you for joining
Thank you
us.
for joining us.
Thanks
This is
for
so
having
fun.
us.
I learned so much. There's all of Neha's information on the screen, the locations where you can find her, and there are 3 of them, correct?
Yes, there's 3.
All right. Thanks again.